So we'll now do the multiple endocrine neoplasia syndrome, so which are a group of inherited disorders that result in proliferative lesions. The proliferative lesions are going to be of either a hyperplastic nature. They can be they can also be benign growths, which are adenomas, or they can be malignant growths, which are going to be carcinomas, right? So we usually talk about men as men type 1 and men type 2, but when you look at this group of inherited disorders, they are somewhat different from the ones that occur sporadically without any genetic component to them. These happen at a younger age when we're comparing them with those that are sporadic. They also affect a lot of multiple endocrine organs, hence the name multiple endocrine neoplasia. And the tumors are usually multifocal, right? And they are more aggressive compared to the sporadic ones. So we have what we call men type 1, also known as Venus syndrome. How do I write this? So they're also called Venus syndrome. And this is an inherited disorder. If you had to characterize it, back then we used to say it as the 3Ps, but it's not limited to the 3Ps. So they have problems with the parathyroid. So for the parathyroid, they will have primary hyperparathyroidism. Then they also have problems with the pancreas. They will have tumors that are endocrine in nature, relating to the pancreas. Then the third P, usually it's pituitary. So they will have pituitary adenomas from the adenohypophysis, but these pituitary adenomas, they usually secrete prolactin. But beyond these 3Ps, you'd find that in multiple endocrine neoplasia type 1, there is also going to be a component that affects things like the duodenum, that affects even the the other gastrointestinal organs, leading to what we call the gastrinomas. You will end up with gastrinomas in the duodenum, in the stomach, in all the other regions. And usually the gene that is affected in multiple endocrine neoplasia type 1 is usually the main, I need to capture this, usually the main one tumor suppressor gene. Right, the main one tumor suppressor gene is what is affected, and this usually encodes for a protein called menin, and menin has like a lot of functions in your transcription, right? So the basically main one is those 3Ps. However, main 2, men 2 is said men 2 is subclassified into men 2A and men 2B. So when you look at men 2A, also called the SIP syndrome, so you're meant to this is where you now think about things like pheochromocytoma. They have medullary carcinoma of the thyroid. So they have pheochromocytoma, medullary carcinoma of the thyroid. They also have parathyroid problems. So they have parathyroid hyperplasia. Right. So these are what you have in men 2A. Then when you go to men 2B, there's some form of overlap between things that you see in men 2A and things that you see in men 2B. But usually these patients, they will also have medullary carcinomas, and they also have pheochromocytoma, but they don't have. So I'll put this in caps. They don't have parathyroid. they don't have parathyroid issues, so they will not have parathyroid hyperplasia leading to primary hyperparathyroidism, right? Then in terms of gene mutations, for MEN2A, we usually talk about the RET proto-oncogene. This is important. For example, you talk about the RET proto-oncogene, which is on chromosome 10, Q 11.2, like that. So that's basically what makes up your multiple endocrine neoplasias. But the main point there is which cancers or hyperplasias or adenomas are part of each syndrome and which genes are implicated. For example, MEN2A, there is the RET proto-oncogene 10q.2. So you can have things like loss of function mutations, which can even lead to things like Hirschsprung's disease. If you remember how neural crystals move in your embryology, right? So this is not limited to the things that we are listing here. There is more to these issues, right?